Okay, so this is going to be talking about your renal assessment for your health assessment class. I do apologize if you hear a lot of extraneous noise. I am sitting outside enjoying the beautiful weather on this lovely Sunday afternoon. So, again, I apologize if you hear a lot of stuff going on in the background. Okay, so during the interview for the kidneys, there's several different things that we need to ask. Are they having hematuria, which means blood in the urine? What color is their urine? Is it dark? So is it concentrated? Is it really light colored? Very dilute urine? Does it have any odors to it? Do they have issues starting their stream or maintaining the urine stream? This is very important with your older men clients because of potential of enlarged prostate. Maybe they have pain with urination. We need to know that. Is there any burning? Are they feeling any other types of pain? Do they feel like they're able to completely empty their bladder when they go? Or do they feel like they're able to go just a little bit and they just are not getting that bladder completely emptied out? They're always full. Maybe they're having to go really frequently. They have that problem with frequency or urgency where they need to go and, oh my goodness, I've got to go right now. It just happens all of a sudden. Or nocturia, where they're having to get up in the middle of the night to urinate. Maybe they have difficulty controlling their urine, such as incontinence, and are they having incontinence because they just cannot make it to the bathroom in time? Are they having incontinence when they cough or sneeze, which would be called stress incontinence? Are they having issues not making it in time because they can't get their pants down fast enough because maybe they have arthritis, or maybe they have a very inaccessible bathroom. They need a walker to get into the bathroom, but the bathroom's not wide enough for the walker to fit, or they have a wheelchair, etc. And it just makes it difficult getting to the toilet quick enough or getting their pants pulled down fast enough. And that would be what we call functional incontinence. Or they have the overflow incontinence where their bladder is so full that it leaks out. And it can leak backward up to the kidneys, or it can leak downward out the urethra. So very important that we address possibility of difficulty controlling the urine. And once again, it's also important to know the reasons behind the incontinence. How much urine do they pass with each void? Is it just a very small amount, or are they going a large amount? Again, important to know. Sometimes the decreased amounts can indicate possible infections. What medications do they take? Because, if they're taking diuretics, maybe they are not taking them at the right time. We really encourage not taking a diuretic past 2 o'clock in the afternoon for the simple fact that then they may be up part of the night urinating, and this can interfere with their sleep and rest. We also need to know what types of fluids are they taking in and how much are they taking. Are they taking in fluids that are high concentrations of sugars or carbonation, or is there a lot of caffeine in their fluids? Because caffeine can act as a diuretic. Are they taking in a large amount of alcohol? All of these things would also offer the opportunity for some teaching. Water is by far the best fluid for us to take in. It's also the least expensive and the most readily available. But some people just don't tolerate water very well. So, again, we need to do some education. If they're taking diuretics, making sure that they're taking in enough fluids. We get some of these older adults and they have an issue with maybe pain with ambulation or difficulty with ambulation, or it just takes so much effort to get up and down to go to the bathroom that they decrease the amount of fluids that they're taking in so they don't have to get up as much. And if they're taking a diuretic on top of that, then that can really increase their risk for dehydration. So we're not only assessing their urinary function, we're also assessing, their fluid status and potential electrolyte status. So as we begin the assessment of the renal system, there's several different things we need to look at. First of all, do they have increased fatigue or lethargy and decreased alertness? Because this can indicate an accumulation of toxins in their body when they have renal failure. Look for deficits in their concentration or thought processes, or maybe they have an issue with their memory. Look at their skin. We're looking at the color. Check for pallor. In other words, are they pale? Or that yellow-gray coloration. It's just a very unhealthy looking color to their skin. Check their skin turgor. Although we know that skin turgor is not the ideal for assessing fluid volume status, we still need to know what their turgor is. So once again, I encourage you to get into the habit of assessing the skin turgor on the forehead, the clavicle, or the sternum. Don't assess the skin turgor on the back of the hand. On infants or young children, you can also assess the skin turgor on the abdomen. Look for changes or abnormalities. Look for bruises, because this can be present in chronic renal failure because they have platelet deficits. Look for wounds or lesions or excoriations in the skin. This can be also caused from a buildup of toxins in the blood, and it results in pruritus, otherwise known as itching. Check the texture of the skin. Clients that have renal failure, their skin's going to be really dry, rough, and it can also be a thickened skin. Then we check for stomatitis and ammonia on their breath. Stomatitis is inflammation of the mouth, and ammonia breath is seen with acute and chronic renal failure. So very important to assess for those. Then we're going to check the kidneys. In those healthy clients, those kidneys are not going to be blottable. In other words, you're not going to be able to shift them around. However, in clients that have that low body fat, sometimes we can palpate that kidney during inspiration. So if you get those really skinny people when you're doing your assessment, you may actually feel it. And if we have a bilaterally enlarged kidney that you are able to move around and palpate, this is often found in clients that have what we call polycystic kidney disease or amyloidosis. If we just have that enlarged kidney on one side, it might be due to a renal tumor. So, we don't normally feel it, but those are the instances that we will if they have polycystic disease, amyloidosis, or a tumor. Or they're just a very, very skinny person. The way we're going to do this is put your left hand behind their back, below the ribs, and under the right flank or the left flank, whichever side you want to start with. Then you're going to put your right hand on the anterior abdomen, just below the ribs. You're going to push your fingers together, going upward from the lower hand and downward with the upper hand, and see if you can't feel something while you're asking your client to take a deep breath. And when you do that, you're feeling for the kidney moving between your fingers. Once again, in healthy people, we're not usually going to be able to feel those. Then you will repeat it for the opposite side. Okay, so now we're going to take a look at your checklist. And I apologize for the appearance of the checklist on the slide. Sometimes we don't really have a choice as to how things look on the slide. But basically, I just copied and pasted. So first of all, we're checking out their general state of health. You need to figure out, ask them, do you have fatigue, lethargy, or do they appear to have a diminished alertness? If it is no, then it will be negative. If there is a positive, then you need to identify that this is positive, the others are negative, but give me a little bit more detail. For example, they are complaining of fatigue, but states did not sleep last night due to studying for Miss Taylor's test. Maybe they have fatigue times 3 days due to family emergencies, etc. Or lethargy, lethargy times 1 week, but states was suffering an upper respiratory infection during this time frame, etc. So again, just make sure that you are identifying what it is. They can all be negative. They can all be positive. Anything that is positive has to have a little more detail to it. But if it's only one that's positive or two that's positive, then you need to put negative, diminished alertness, or whatever it might be. Then you're going to inspect the skin. What color is it? Skin turgor, remember, less than 3 seconds. If it's over 3 seconds, how many seconds is it? And where did you test it? So was it forehead? Was it clavicle? Was it sternum? Do they have bruises? If there's one little tiny bruise here or there, not a big deal. But if they have multiple bruises, if they're large bruises, you need to describe them. Where are they located? What color is the bruise? The approximate size and number. So, if there's multiple bruises, you can put multiple bruises to right forearm. Client denies knowing mechanism of injury, or multiple bruises to right forearm. Client states was in a motor vehicle accident 5 days ago. They're in varying shades of yellow and green, large bruises, etc. You can also put the approximate size of the bruises if you would like. But I need to know at least, are they small? Are they a medium size? Or are they very large? Do they have any wounds, lesions, or excoriations? The excoriations are going to be more from scratching, and they'll have those scratching injuries potentially. What is the texture of their skin? Is it very rough? Is it very smooth? Do they have any edema? And you're checking edema in several different places. I'm not going to ask you to check sacral edema. However, I do expect you to check pedal edema. So do they have edema in their feet? Pretibial edema, so in their shin, and orbital edema around their eyes. If they have edema, you need to indicate, is it pitting or non-pitting edema? Is it bilateral? What location? If it's pretibial, is it 2+ pitting edema? And determining the depth of that edema has to do with how far you can indent the edema, and if it stays. So 1+ pitting edema, it's just going to be mildly dentable, and it returns to normal very quickly. 2+ pitting edema, it dents pretty easily, but also it's going to return to normal pretty quickly. 3+, it's going to be very slow to return to normal, and it's going to be a pretty deep dent. And 4+ pitting edema, basically you push in on it and it stays, and it takes forever for it to return to normal. There's better descriptions for the edema, but those are pretty good for letting you know the different types of edema. And once again, you need to let me know where you find it. So if they have edema in bilateral, pretibial areas, or is it just one, etc. Inspect their mouth. You're looking for stomatitis, and stomatitis again is just going to be inflammation. So it may be red and kind of sore looking, and you'll find that maybe on the tongue and the sides of the mouth, the floor of the mouth. And do they have that breath that smells like ammonia? If they do, then that's not good. So it's either positive or negative on these two. You're going to inspect the abdomen and flank area for symmetry and discoloration. So basically you're doing a visual. You cannot do this through their clothes. They have to lift up their shirt and maybe pull down their pants just to the lower hip level. Preferable to obtain a weight, because if they're having kidney issues, remember renal failure, they're going to be retaining fluids, and that means we're going to have a weight gain. You can weigh them on their own personal scale and ask them, how does this compare to your normal weight? Because we obviously don't have recorded weight from the last visit, etc. Then we're going to auscultate their lungs for adventitious sounds. And remember, these are going to be abnormal sounds. When you're auscultating the lungs, this is a reminder. We have 5 lobes on front. We have 5 lobes on back. And I'm only asking you to auscultate one place on each side. So on the front, you're going to be 1, 2, 3, 4, 5, 6, and remember you're going from side to side. You're going to do the same thing on the back, and then on the side you're going to be doing 1 on one side and 1 on another side. So if you're hearing abnormal sounds, you need to indicate where those abnormal sounds are. If you're not hearing abnormal sounds, you can put CTA, which is clear to auscultation, times 5 anterior times 5 posterior times 2 lateral, and that will be acceptable. Then you need to auscultate the abdominal aorta once again and the renal arteries. I know we just did this last week with the abdomen, but we need to do it again. And you need to use the bell of the stethoscope, in other words, the small part of the stethoscope. Try and listen around those bowel sounds. And then get their blood pressure. When we have fluid retention or renal failure, the blood pressure is usually going to be higher. So I want you to record what the blood pressure is. So once again, auscultation, CTA times 5, anterior, posterior, times 2, lateral. With the auscultation of the aorta and the renal arteries, negative for bruit or no bruit. The blood pressure will be the reading that you actually obtain. Then we move on and we're going to start palpating for the kidneys. And once again, it gives you the steps for doing that. If it is blottable, in other words, if you feel the kidney as you are doing your palpation, you need to describe the size and consistency. Then you will do it on the other side. If you do not feel the kidney, it will be negative. And you can put negative bilaterally. I'm okay with that. But if you feel it on one side and don't feel it on the other, you need to make sure that you put down which side you feel it on and describe the size and consistency. And the last part of the checklist, you're going to have them in the sitting position and you're going to palpate or percuss that costovertebral angle once again to determine if there is any tenderness. Make sure you do it on both sides. If it is tender, what side is it tender on? Describe the pain. Remember your old carts. So start off with basically we're needing to know the characteristics. We're needing to know a number on the pain scale. We're needing to know that how long has it been going on, the duration, etc., etc., etc. So very important, if they feel pain, which side, and describe the pain. If they do not have any pain, all you have to do is put negative bilateral. Okay, and then we're going to once again palpate the bladder. So ask them when they last emptied that bladder, and then you're going to palpate for the bladder. If you feel it, do not put just positive. You need to put slightly distended or distended, firm, rounded. If you do not feel it, you can just put negative. I want to remind you that if you put an X somewhere, that means that you did not do this. If it's a place where you're supposed to be documenting, that means that you did not do this. So no X's in the blank spaces. Fill in all of your blank spaces. Make sure that you are reading the steps. It tells you exactly what you need to be doing and what you need to be documenting for. Again, if it's negative on both sides, that means that you did not find it at all. If it's positive, that means that something is there or something happened and you need to be describing it, location or characteristics, etc. You will be required to complete this um, assessment on someone of your choosing. It does not have to be your lab partner because we're not going to be in the classroom for this class. Make sure that you add on your checklist who you are assessing. So I kind of have an idea, are they an older adult? Are they a child? Etc. So that will help me kind of identify if your assessment is potentially inappropriate, uh, your documentation is potentially inappropriate, or, maybe there might be something that you shouldn't have been assessing in someone of that age, for example. So let me know who it is and approximate age. It doesn't have to be an exact age. And if you have any questions, please feel free to email me. I will tell you that I will most likely not be on the computer until Tuesday morning because I will not be back until late tomorrow night or late Monday night. So, if you send me anything via email, I just will not see it uh, until Tuesday morning. So, again, don't hesitate to let me know if you have questions. You are still required to do this assessment and do this checklist the same way that you are every week. So, have fun, and I will see you all next week.